again, this is Dr. Keneth Hall. I'm a board certified surgeon. And for this next minute or two, I'll spend the time to talk about a very important topic, and that is abdominal wall reconstruction. That is surgery to repair hernias. First of all, what is a hernia? It is a very common question that I get asked by patients from time to time. And this basically is a weakness in the abdominal wall or musculature in such a way that there's a protrusion. Oftentimes patients may see it as a bulge, and they may present that way complaining of pain. Simply, this weakness is sometimes congenital or it could be acquired. Congenital means that they were born that way. As it relates to acquired hernias, these are maybe related to strenuous activity, such as patients who may be working in construction or positions in which may require heavy lifting. And those abdominal wall muscles could become displayed over a period of time, and they could be this weakness. Now, how do you repair them, is the question. Now, they can be repaired by several different means. Most of the commonly employed techniques that I use are minimal invasive techniques, which means laparoscopic surgery, robotic surgery, which is a means by which we make a very small incision and fix these hernias. But what is the cause, people may ask? Again, there are different risk factors. Some people are more prone to these or susceptible compared to others, and there may definitely be a genetic predisposition. Now, once they're identified, typically on examination or by a CAT scan or ultrasound findings, then it's confirmed by me in the office. And based on the type and the extent of surgery, patients may need medical clearance. This is just to make sure that the patient can tolerate the operation. Surgery is normally scheduled, and most of these are done as an elective outpatient basis, meaning that patient will go home the same day with very little pain. And that's one thing that I have an expertise in. I have a special cocktail of medications that we give to reduce the amount of narcotics and the postoperative pain that patients may feel. In effort to reduce the amount of pain, in so doing, we also improve the compliance and the patient's outcomes. Patients are able to get back to a level of activity that they had previously prior to surgery, and in so doing, that reduces the complications overall. Now, laparoscopic surgery simply involves making little tiny incisions on the abdominal wall and placing a mesh in a different position after the hole has been closed. The purpose of the mesh is to reduce the tension and reduce the chance that the hernias could recur. Now, people ask all the time, what is the mesh made from? There are two types. One is biologic, the other one is synthetic. And that's typically selected based on what's going on with the patient for that time. Ultimately, once the surgery is done, the patients will be seen in the office within approximately 1 week of surgery. And by then, most patients are driving, and some patients may even go back to work, depends on what they're doing. We're here, pride ourselves in this hernia center, in that our staff is very caring and attentive, and our outcomes have been absolutely amazing over the past several months. We look forward to seeing you in the office for a consultation. Thank you.